Badia, Timothy and Uncoto, Erawan Radio, and Pampua, Asam Pampua, and Ratumpa, Erawan, Yebo, Pampua.
We Omandi share Majuma Kwaba Bium de Ba Yensom Jumedi so Ewo Erawan Radio TV so ye kam Sabre Twegu Ewo Sabre Twegu Ewo Erawan Radio TV so enonti ubetumi adwen ye wo Facebook se wo dwen wo Facebook a ubetumi abomoden a enso na wonso wa share link no na obi nso a ono nso APB ahwe no enya bi sanso na se ko YouTube a ehon nso nsa betumi akan wo YouTube nso kwa Erawan Radio TV wo bomoden a na wa subscribe na afi nso wa click adoma so se de be ya ye de bibia to ha onsa beken bie last week ye yɛde asɛm bi eto mpanimfo anim efa ekwan bi a ɛda deduako ɛkɔ afram so ɛna yɛka ekwan a da drɔbɔnso nso de kɔ afram so ɛna drɔbɔnso nso tu deduako yɛka ne nyinaa ho asɛm srɛ mpanimfo sɛ nkebe yi a ɔmo nhwɛ sɛ ɔmo betumi aboa na ɔmo atwa saa ekwan no amaye nokremu mani agye na de ntia mani agye ne sɛ efieda listener na ɔde fieda etwa mu no listener na ɔde request ne bae no ɛfrɛ me na ɔfrɛ me no de ɔka kyerɛ me ne sɛ ne nkrɔfo no afrɛ no sɛ asɛm no yɛ kan no dwoada no say ye can dwoada yes yemfa ne say ye can dwoada enani 2 weeks pepe ne ye kan asem no na omo friend Friday say the duako to afram so kwan no omo betwa so yeda mpanimfo whoever in ete ya otu saa anamo no yeda na sepa na emu no adesrede a yede to ho ne se senka yebetumi the gravels bi eguso a yenkasa yede quota akra na eguso ba yebetumi the gravels eguso se de be ya insutobre ni du a enhohoro ekwan no enko but ade a nika na de ne se yaye instantly no yaye den yaye de ewo se ye anase yenya resource as to request a yede to mpanimfo anim no but yenkai say triangle road na ye ka ho asem enti sese a omomodea aye deduako to afram so no yesre say mpanimfo no hwe drobonso to afram so no na drobonso to deduako no so omonhwe na omon ntwantum se de be ya enkrofo a ewo saa bia ho no omakone abadie no ebeye mre ama won eno achi nso ye ka telephone reception ho asem say yesra honorable Sam George se wobetumi a engage MTN for ana se Vodafone ebia wobetumi a engage o ma ombetumi akosi omopo no bi ewo saa 3 communities we emu no na aboa ama omo telephone reception akoyie no ebetumi aboa listener no asem bi osan send bre me kwasieda no se se base obi yare kra na ebia mo peka bia na mo pe kwan bia mo befa so a mo ne bekọ ba bia na yese wo ye call na unya response a ose chi se ukope ba bi gina ansa na watimi aye call no ɛno nti mpanimfoɔ yɛsrɛ mo as Oliver will ask for more. Moayɛ deɛ di kan no Deduako ne Aframso kwan no yɛda mo ase. But Drɔbɔnso Aframso, Drɔbɔnso Deduako, monhwɛ na monyɛ ma yɛn na mmoa. Na Deduako Drɔbɔnso deɛ menim sɛ da bi a mebɔ pɛ na makae His Excellency John Dramani Mahama. Matie ne speeches bebree a ɔka Drɔbɔnso ho asɛm. Nti ne timi sɛ Drɔbɔnso yɛ baabi a he's familiar with the place. Nti no menim sɛ nneɛma no a akwan ahodoɔ a wɔn twa wɔ Ghana no ɛdɔɔso. Now they are concentrating on the trunk roads. Na for wɔn wie ansa na wɔn aba kwan ketewa no. But district assemblies any highway kind of say feeder roads for nso betumi ayɛ biribi kakra ɛwɔ saa aspect no na etumi aboa ama nnuane a saa 3 communities wei edua no ankɔsɛe kwa na etumi aba krom ama wɔn atumi atɔn de enya wɔn sika. Ɛnɛ na me expect sɛ me nsa bɛka Dr. Opoku Agyeman na ɔyɛ onimdifoɔ ɛwɔ healthcare industry no. Nti na maadwene ne sɛ me nsa ɛka no a na me ne no discuss yɛahwɛ sɛ yɛbɛtumi akɔ primary healthcare na ya introduce wɔ Ghana no sɛdeɛ ebia historically no sɛ ebi kura ebi wɔ hɔ yɛayɛ bi pɛn ɛna sɛdeɛ ɛkɔsiiɛ ɛna yɛsan bɛyie no nneɛma bɛn na ɔdwen sɛ nka ebi a ebetumi aboa a yɛbɛyɛ a ebetumi aboa ma program na yɛ introduce no ɛbɛkɔ n'anim. But me nsa nya nka no nti no sɛ me nsa ka no a mede no ɛbɛto so na afei me ne no adi saa nkɔmmɔ no. Last 2 weeks ɛna mehu saa asɛm yi a ɔsagyefo Amoatia Oforipani a ɔyɛ the overlord of Achimabuakwa ɛde bɛtu edwa. Nana m'ani nsan mahu sɛ amanfo bebree aka ho asɛm bebree. But sɛ wobusa me opinion a me deɛ mɛka ne sɛ asɛm na Nana kaeɛ no ma yɛmfa no in a negative sense, but yɛmfa no in a positive sense. Why am I saying that? Don't let us criticize Nana. Am I a clear indication say there has been a gap? Because one who say Ghana no senka be a former president Nana His Excellency Nana Adodankwa Akufo-Addo senka obeye hospital na siesie no yie nso a nke bia yen Ghanafoɔ ya kro ya besan ba beka se obaye no onsi hospital ba bia ba ni krom hospital de oye ne yie. Sometimes no yen amanyofoɔ no ne yen citizens no timamufoɔ no ma politicians no ensa yɛkyekyere wɔn nsa egu wɔn akyi na yɛbɔ wɔn yam. Sisi a yɛkasa yi yɛmfa ne sɛ yɛhunu sɛ ɔmampanin John Dramani Mahama ne kurom bɔle wahyɛ aseɛ esi hospital kɛseɛ wɔ hɔ. You will see how people will talk. No ɔbaeɛ no ɔnyɛ hwee nso hwɛ hospital akɛseɛ a ɔsi wɔ ne kurom deɛ ɔyɛ. Mekae sɛ yɛnea ɛbra Nana Addo yɛ kibi kwan yie no yɛ de saa deɛ no bɛbɔɔ n'akyi sɛ ɛna kibi kwan deɛ wayɛ ne kurom kwan deɛ wayɛ ne yie, but other areas ne deɛ ɔmpɛ sɛ ɔbɛyɛ. Enti no yɛnhwɛ adeɛ no in more of a positive way. Na yembisa yankasa yen ho se yene timamufo no yenso yenka ho bi na saa nneɛma no sisi ana. It is accepted say Nanado edi can say MP ansa na obedi president or ewo ebuakwa ho a na obedi president the whole Ghana. Enye ono nko a family, the family of Oforia Tano ene your friend is saying the royal family no omo nkrofo bebre na da so sisi a meka se kro omo nipa na da so ye MP. So enti se Nana beka sa asem we a optics no doesn't look good, but media so ubusa media meka say it is because of the fact say young Ghanaians nankasa no say president bi betra so na bibi woni kurom na o ye ni yi a ye de no bo na chi enti no na ebia ono so fele say okoya na wanhwa akofa asemaba ena ebiom na nanso no de ha me ne say within the 8 years no he enka obetumi a voice sa asem way out ama ebia aboa ma Nana Adankwa Akufo-Addo his excellency former president akoye na yakase o ohene no kra na appeal enti na okoye, but Nana kept quiet for 8 years afei ansa na okasa ɛhɔ no ɛna ɛha me kakra sɛ nka Nana kasa 8 years ni nyinaa nka ebia nka his excellency Nana Adankwa Akufo-Addo begina so de akoye na akoye se ohene na request nti oye so enti no I think say a coin bi so no the optics doesn't look nice or good, but then media so ubusa media the current government should take steps to face that hospital, because you know what say or fixes our hospital na ebegya dinkese de ato ho ama no say de ofi krom ho no kra bedi ade no wantumi wanyo, but we no a onfi krom ho no ena ababeyo Rollins bedi ade area o deprive no pa a Volta region because na ho no free. I can give you series of things a presidents aba omonkase krom no they are not able to fix that place because of the way man Ghana for ye kasa na ye yamanyosem. Volta SOFI hugely under Rollins because whilst he was constructing roads in Kumasi and other places, no, Volta region was not getting that simply because so Ofelese Okoya Nikrum na Oye, and people will talk about it. And yes, Nana, it's true. 100 years in Chebi Hospital still are any quality laboratory, but me bisao Nana, you kind of say Osajifo Amoti for penny. Nana, I think say you have a lot of subjects omo Ghana, omo well to do, and some even in the diaspora. And why don't we take the Asantehene approach that he did about 2 years ago? Say, okay, machene abaya ma, and let me raise my own funds and try to fix Komfo Anokye. And Nana Osajifo Amotia Oforipeni Mesrel Nana wanimu a senka ubetumi afa saa initiative no so a enkebeboa. Even though I'm appealing to the government to step in and help, no, you can also mobilize your resources from your, because I know a lot of people from the Buakwa area, so well to do, very rich. Well, if we appeal to them, ebia ombetumi aboa ama yɛayɛ saa hospital yi yie na atumi aboa ama ayarehwɛ ne ayaresa akɔ so wɔ Kobby Government Hospital. Enti yɛne a yɛte social media ayɛ sɛ yɛtoto bi ma ne nana no, me deɛ me perspective na mede aba no, mekyerɛ sɛ nana asɛm na ɔkaeɛ no, albeit sɛ ebi a wobɛhu no negatively no, it shows the kind of politics a yɛyɛ wɔ ɔman no mu sɛ obi bɛdi adeɛ na ɔtry sɛ ɔbɛyɛ ne kurom yie a yɛka ho asɛm. And case in point yɛ nana ado no a ɛberɛ a ɔkɔyɛ Kobby kwan sɛdeɛ amanfoɔ kasa faa ho, ebi a ɛno ɛna ɛma a ɔdecide sɛ no, ɛneɛ menkɔyɛ hospital no koraa nso na yɛasan abɛka aka ho. Nti no, sometimes no, sɛdeɛ meka no, yɛne a ɔmanfoɔ no, sɛdeɛ yɛkasa, sɛdeɛ yɛka yɛn nsɛm ne sɛdeɛ yɛyɛ amanyɔsɛm no, ɛno na ɛma ebi a saa nneɛma wɔ bi esisi. Metro mass transport anaa transit, metro mass transit a ɔmampanin Kufuor introduce yɛ some years back. Mekae sɛ ɔmampanin Kufuor introduce yɛ no, there was a fleet a yɛde maa wɔn, a fleet of cars a yɛde maa wɔn a wɔmfa nyɛ adwuma. As at 2026 a NDC baa power a wɔn bɛtake over no, na cars no majority na sɛe ama yɛ auction. Meka saa asɛm wei de abɛsi asɛm so because I remember say matena ha ne me panel aka lack of maintenance culture ɛwɔ Ghana. Ɛno nti ɛma yɛyɛ project fine, but at the end of the day no, yɛntumi sustain project no because yɛni maintenance culture. Yɛni maintenance culture. And then we end up say yɛbɛ lose bibia nneɛma bibia yɛde sika ɛbɛhyɛ mu no, na within a short time na saa tete apansa. Obi bɛbusa saa deɛ na meka saa. Aban no ahyɛ aseɛ de vans ɛreba a wɔn pɛ sɛ wɔn deploy in areas a yɛ na edu peak period a corridors edu peak period sɛ anɔpa a nkurɔfoɔ kɔ adwuma, anwummerɛ a nkurɔfoɔ apɔn no, kaa ho yɛ den no, ɔpɛ sɛ ɔdeploy ɛwɔ hɔ. Wɔn adi kan de 100 aba, wɔn de another 100 bɛba. Na I think sɛ September, wɔn de last batch of 100 no aba. Nti in all no, yɛde 300 cars anaasɛ buses ɛna ɛba bɛ augmenti fleet na sesei metro mass ɛwɔ no. Mini problem. It's a good initiative. But yɛmbisa yɛn ho sɛ, will the people in the helm of affairs in the metro mass transit will wrong a momfa nkyɛn sɛ meka metro mass transit a na sɛ ɛnyɛ saa na Ghana deɛ nti a momfa nkyɛn because baabi a mewɔ yi metro mass no saa na yɛka metro mass transit. Nti yɛbi a saa na minim no nti na ama meka ne saa no, but minim sɛ metro mass, I think sɛ transport anaa bibi, I'm not sure, but the emphasis metro mass transit said ye no higher. Well, mini problem to augment it is not a problem. But me how kesi say in about 3-4 years time no, Yensom ma meka say ya auctions are cars no because it's beyond repairs ana. Question me bisa na say ye order and I say ye to cars no after sales service contract ka ho ana. So after sales service contract in Kanwa, the question is say yede cars na ba no ye be enter into service contract with another company a wo Ghana obetumi a service car no from time to time ana. I think said the management must tighten their system in such a way say enkoba say ebeye te say ambulance His Excellency Nana Addo Dankwa Akufo-Addo kofa ba ambulance I think about 300 or so, the same amount of ambulance or the by 275. I don't quite remember because that constituency be abenya baako. But at the end of the day, no, you know be an or be kofa cement. Ambulance na say di nipa hospital no. Okwabrane de kotwen cement. Enti no say ye tono nye den sa, but maintenance is my issue. Enti no mesre say mpanimfo a mo initiate sa program we na mo decide say mo be augment the fleet of metro mass no enye problem kra e good, but then mo share plan to make sure the cars are maintained, the cars are supervised well. Na enkoba say the returns cry say efficacious no mu ba na eba metro mass no na fe enam conductors bottom, because we've seen some before. And you know, I think say let us all come to a agreement say aban no di ni sika hye bibi mu a yenhu ni say aban no ye nyina enti no ye behwe ade ni ye. Now I come to the passengers who will be using this vehicle. Say aban ka ade a yetremu a efin bi a yetimi yegum. Say aban ka ade a yetremu a we don't take care say. I think say yeni timemufo no so say be ya car no be cha ma ye nti no, when we board the cars we must make sure say yen leta car no mu yen nyemu basabasa, because yen sa it goes to add cost to the company say so muko cleaning all that, and that is also going to take some money out of the company's account. And you know, as two company ni for say omo making sure say omo ebe maintain cars no, yen citizens nankasa so say ko use car no a yen mo modern say ye bedi ehuni na yen ma basa ye ana say yen nyema basa ewo car no emu. Enti no still a mensa enka doctor nti ye betwa so. I don't know what is happening, but metie a couple of farmers, metie a couple of traders in produce. Omo nyina my lucky mensa aka doctor. Metie a couple of traders, a couple of we are omo eka say oma ye nobaye nenso yento. Say the latest one ye onion farmers are omo northeast region. They say omo nya nkrofo kra na omo beto omo niema no. And it's quite make say demoralizing, because look, say ya nhwe ni yi a ebedu baabi no akuafo no abamu bebu, enti they might not say omo beye ebe ye efuo no. Enunti I am very happy say Ghana and as a ministers of agric any ekuo bi a ye friend no Ghana Farm Gate, ye friend of Farm Gate Limited, a Ghanaian company. They deal basically in produce. Omo exporto produce. Omo ni abaino assign contract say they're going to make sure say they're going to produce in a partnership, and they're going to produce as much as many as 600,000 tons of tomatoes yearly. What is going to happen? They say the government was a little bit scared, says you produce no excessively. But here is Farmgate that has come in to sign the contract, say 600,000 tons mu produce better. And so when they buy and the Kobby say omoto wie na fe almost supply Ghana and I say still they need to export. They are already in that business. It will be easy for them to export. I went online to look up for Farmgate, and so go online and near my Kafa Farmgate hono very good. And you know, I think say this is the time Burkina Faso band should help us. So a Greek minister what started process but said the American the effective way of doing it is kind of saying outgrower farmers and I say small holding farmers now. Yeah, one major farmer amongst them one commercial farmer among them. Now outgrowers then we will be able to buy the items and I say produce from that particular a major commercial kind of saying farmer na outgrowers ni nyinaa de abrɛ no na government nso akɔtɔ afi no anaasɛ Farmgate akɔtɔ afi no I think say a system ebi a practice a ebetumi aboa ebiom nso no I will commend the government. Why am I commending the government? Say omo try say omo be pushy the narrative and the idea say school feeding obia akwala bia anaasɛ aduane bia yɛde feed school feeding for no enye de ya produce anaasɛ ya produce wɔ Ghana. And I think say yetimi ensure say omo enkoye say omo ekɔtotɔ nneɛma de omo ayɛ nada kwan bi de akɔfa nneɛma bi de abɛwura mu de ama nkwala na sɛ ebe use made in Ghana nko ade a I think say ɛbɛboa ma farmers no nso enya nneɛma kakra anaasɛ sika kakra de ato mu bɔtɔ mu na etumi aboa. Dr. Mpacho Otimenka. Dr. Otimenka. Dr. Otimenka. I don't think so, Dr. Otimenka. Yɛbɛtoa so na Dr. Otimenka na ɔbɛmoa. Dr. Otimenka. Still Dr. Otimenka. Okay, yɛtoa so. Adeɛ baako nso a mani etwa so na ɔtwe mu a mepɛ sɛ meka ho asɛm baako nso yɛ finance minister Echo Bob Benso oil palm plantation. I think say they have decided say omo beye oil palm plantation and I say omo pese omo go into oil palm. Into what he did, ne say he went to the oil palm Bob Echo understudy the omo na omo share the way forward a omo betumi replicate saa de no other parts of the country. Said the bear omo betumi ahya ase produce abe ne dodo mu na afi omo atumi ɛde ayɛ nneɛma ahodoɔ a abɛ etumi yɔ. Sɛdeɛ da biara meka no, Indonesia ɛne Malaysia ɔmo bɛfa abɛ efiri Ghana. But omatimi develop abɛ no ara to a point say now no, yeah, I think say doctor ultimate cafe still me doctor entiminka omatimi develop abɛ no ara to the extent say ene abɛ no ene the backbone of Indonesia and Malaysia. Ɛno nti yɛn na yɛde ade ne baeɛ na ɔmabɛfa ko develop saa no, we are now looking at revamping our sector. And I think I will applaud the finance minister say call Bob, because when I listen to the officials of Bob, almost when the first time a minister be aba try to understand the process. Now ocean nipa omo employ won ho na is quite a large number of people. One guy that they interview no a graduate a ho na okoye in national service. Uwie na no na omo fa no. I think so oye something related to agric. And okoye ni we ho omo fa no. Kuta ni iPad, the tablet. Ena odi eye na adwuma ewo ho. So utimi hu say it's advanced thing na Bob for no eye. And I think say it's good say Dr. Kisel Atuforsen akɔhwɛ, but enye ne hwɛ ne nko a. I think say wakɔhwɛ wie no, they should start building the structures ebeboa ama yetumi atake off. Na ya produce enough, because look, you rely too much on cocoa, you rely too much on gold. Now these two commodities no, cocoa are failing. Cocoa are failing. So the cocoa are failing no, the same way na gold unso betimi are failing. And you know, I am appealing to the people who are responsible for this palm plantation and palm oil palm producing program. No say omo make sure say omo beye ni ye na etumi a benefiti omanfo, because area bia omo beye bia no, trust me, ebetimi ama nipa bebre employment, so as to cut down on the kind of say youth employment abeye problem ewo oman anymore. I think say finally before still me doctor and cantino ebia ye de primary healthcare no ebe twa to kra. Another video me hu ye eye esukufo nkwala omutwa ensio enye se omutwa nsuo no se twene bi da so ana bridge bi da so na omutwa o omo nante nsuo num ena omo de akọ school. Me try se avetekpo wo voter region ekrono din no avetekpo wo voter region, but me nim constituency ko a ehya ase ena me nim district ko a ehya ase. But whatever constituency any whatever district no, I think the MP and the district chief executive should take immediate step to rectify this situation. Because here dakro enkwalai be lose life because of the fact say they are seeking education. Education your right. Yes, it's their right. So how come say education your right? Now so no, they can't access it easily. She say almost struggle efa ensure, and you say ensure say ensure keke a river. And yen can say ebia nsuo ketewa bi ne yɛka ho asɛm river. Enti imagine say at the time a river no be yiri no, how would it be for these kids? In school and they still have to go to school. Enti bebia this would be a avetekpo and our constituency be a share no. I am pleading to the parliamentary the MP and the district chief executive to come together and ratify this situation as early as possible. And sana nkwalani bi ahwere omo nkwa, because trust me, say nkwalani bi hwere omo nkwa in this circumstance menye sure say nyame de beche. We will never forgive ourselves, because this is something that we can do. A small thing I betumi ayo. We MPs easy to do it. Inti mi hu die nti a omo ntimi enye Dr. Memo Akwaba. We di nka wo ye ache
Yeah,
ha me.
my
Me
brepa
kopa.
my brepa is on me bemu.
Aha, me bre kopa nti no, but me try say ye be zoom straight to the primary health care no, because ade bi a eho hia me pa. Na wotwe mu na President of the Republic of Ghana, His Excellency John Dramani Mahama, elanche sa program yi primary health care ewo Ghana. Na minim why health practitioner yi de ebia na wo historical antecedent and as a historical background bi about ebia primary health care in Ghana. Ebia obetimi ni yen a share ansa na yatoa so.
Yeah, the no mamini kan chia tiefo ni nyina. Na ye kenyan Ghana for so mutie so mutie ya asopam. Oh say ye ka primary health care. And say primary care ya na so ye dante makakra. Primary health care no community based. And a primary care no individual based. But we share primary health care na engulf primary care no.
Okay.
On the other hand, no say primary care no a part of the primary health care no, in general. But all classify in here primary health care no, and cover primary care ni nyina. Na Ghana ye shall see ye primary health care earlier 70 ho baby. And yes, bibia up. I'm say parallel studies normal area. And normal spreading a little bit to Ghana, but and to me, uncle baby bray. In it, no, and almost establishes this system, primary healthcare system. Almost establish clinic won't cross health post. I won't cross Santa Lab, I will Kurana Simbina, a sugar crown. And almost establish a health center, district level. And at regional level, no more establish regional hospitals.
Hospitals.
Na just the flow chart ne say obi e wa kura bi asa clinic ho ha. Sa clinic na wo no no involve traditions na it is traditional women na omoji awo wo mo mbema health education. Wo mo say healthcare for no ba be hia o be hia mobilizing kofo na ana nkwala ana pimfo ana education bi on person de ma won bia no omo ebehia ho na omo de ama wo. And BBC so na omo person omo communicating message into the health team na your coordinator no work crowd no ma ono be communicate to any of the centers na sa ipakrona ohia moa no eso okono on be communicate ono. And the flow chart no koya ba be drew regional level and omo establish specialist hospitals. Ebi Komfanochi, ebi Kwalebu, ebi Oforidia, I'm the Central Hospital,
Central
all
Hospital.
other hospitals now. A war a honeymoon and in the central referral areas. In the number almost establishing where you and anti-team and a bino society, and Tina Bandit sign or my buying and no to me. I'm focused on mobile buildings adding up. Now, meanwhile, now the history of healthcare system no, a free Cuba
Okay.
for a war, system you honor. And no woman or more one day no acquire in the rural community level no crana yachichemua yade ya empower nkurase for no more ye nyuma bi e de bo healthcare team no just how Cuba for the end more family doctors, family midwife, family family bia on the omo kokoma education na omo to their homes and
Okay.
bia community centers bi ko shia na omo de sa education na ama in fact, the primary healthcare concept, no, Hona free by. Now we are also told that Cuba is one of the best countries or more good healthcare.
Okay.
Besides Japan, Sweden, other places, Netherlands,
Okay. All right. Doctor, okay.
in
It
the
is
real
saying
history
now.
of the yeah,
Okay.
but who question be able to be some.
Yeah, doctor, the person may be say, it is now ya establishing no. I think say mama ma background kakra ya establishes a free primary health care. National health insurance no ho. And ya establish Ghana medical trust fund. Inti ya benya 3 levels ni. I think that the first level no ye normal said ye who can ya and a second level no health insurance ye say be ya refer call district hospital no ni ade. But the trust the medical Ghana medical trust no comes in when adna koye be a chronic. So nipa ni here dialysis ni na se for ni ade na national health insurance no cannot cater for it again. Then the kind of saying Ghana Trust Fund no or apply, then they come in to help. So on say the system no. And me person me bisa say sa
Okay.
me person me bisa say sa primary health care na primary health services now Ghana for no and I say president no person or establishing and I say you know what will be your advice would be ma say bia how to sustain it say bia and the umbetimi aye dia improve no in as they roll it out.
Well, almost we primary health care na the main objective is on the community level no. Na woman what to do and what not to do.
Okay.
Na woman how to prevent disease. Sorry, yeah, and how to
More of a
make sure
preventive.
disease be disease be anchor above level be no any life near higher risk. Like just on the other hand, no, near will be a friend of primary, secondary, and tertiary. Primary level, no say you be preventive say
Yeah, no.
Secondary level, no say when you are you be born who by near yari ne flu, so the be yari no intimate ko baby abu. Tertiary no ya ubi a when ya bibi de say chronic yari bia ya kwako rehabilitating. So na sa nema we nyina no categories can once me say primary, secondary, family, meaning I link it with the healthcare system number establishing. So as you establish primary healthcare and yamau clinic, yamau health push, yamau health center, yamau regional, yamau referral. In the cases be a court send it's a now you are talking about a car. In fact, primary healthcare in the concept can be reduce fatality death rate, not reduce cost. So, and why is it very
How is it
difficult?
going to reduce cost? Because abano betue sika e dey ama volunteers ne nurses ya ombeko nkurase omo cars awakoto ade aba motorbikes awakoto de aba vaccines or de beko. How is it going to reduce cost? To me no I would think say e be increase cost more.
one says a one person death is very expensive. So classify when people back from time or start productivity, accompanying time sika ubenya is very huge. The impact in the community is going to be very, very huge. And so to me, my sustaining number year juma about money. And the money boa ama woman atimi healthy no my juma is cheaper than say so and cost of treatment are very expensive than cost of prevention. And enipa na omo koye adwuma ni nyina no the omo a part of the costing na what the nyina bom na wo chema womo a womo ahwe omo anya nkwa no wo be say e cheaper than womo a womo agya womo nyina ewu
no anasa womo anya chronic disease na say omo ko tertiary level
the most expensive part na womo anya chronic disease because ono a onye productive ono also a oye consumer or ye consumer on consume nipa ba sika and then you no sika consume or no sika or consumer society sika or consume a country sika why and no be a better be only ye de command and an your 10 who are no so be adwuma price or ntimi ngonko ye and ono so ka senko show bi when you senko show bi nipa kon wentimi anhwe no ono nipa kon bi am so abaye and the person is very expensive in that context.
Okay. Na advice ben na wo de be ma because me who on social media say almost the tricycles any motorbikes aba but people were sort of laughing at it say na ambulance why na betna pragia ambulance money ade but I think say wo share the explanation and wo share say the omo ye no a metie nurse ni baako o se obia mpekra na ono ni community yemfa mre no and the argument ni say sometimes onam form onanti most of the time and the villages na oko ma education na oko ma vaccines na sefo no enti with this one no coming no ono hu ni say it's a blessing in disguise I be boa no. I had an experience because Mrs. Sister Penny Medina Chimienu a community health nurse. And baby I transfer any call ebia me Kobby. Me anasa me visitino. Oko Zezera me ko oko you can say Sumahin crew me ko oko Sampa me ko or Satifio Krakweju me ko Krakweju oko KBK me ko. One winti sa wo hwe terrains na some of the nurses no eye adwuma wo ho no a and I say as they no so no said they wo ka no community based until you need to reach out the community. Some of the communities in so no the only means I obetimi dey reach ya na maybe say be audi motorbike and Prague abeko like the biakoni afram so na ye ka ho asem ne drobonso ne afram so kwan a na ye ka ho asem say the only thing na omutimi dey ko no Prague and motorbike no such a community no sa emmeboa won dan say amanfo dwen say edi ye asresem no.
Let me just re-emphasize the metaka bia. When you talk about national development, idea about the country as a whole, young politicizing. So, idea about country ones usually minimum aiding commamita cassette, baby the school, baby this a rules, baby this a electrification, baby this a water. They a surprise country no. Say issue banner or more discussion, they should not politicize it. Because our politicizing now will cause a very harm to the nation. Idea a beboa say bibisa near na a beer, or beer, or the beboa. I'm an a irrespective of the party I want, me patcho, just bring it. If it's a cost, nipa kona oye na ebi a wadwene na wan fan ko na esenka wo de koyanka beboa na ekoso ge be pio afiri ho aba no enye nipa kona ode ade no ba na etua eye nyina na etua And it, collective decision for healthcare system should not involve politicization. As I said, a collective decision. More na madwene ba mo busa mo toto mo ho ano na mo hunu ne mo pesa mo ye na no mo aye no pepe and say obi ka say we are the best yes obi because those days na near Kasan they were using motorbike me ka say me kwa no na I was using Suzuki that's a Suzuki 22 say no me de ma me na me de me de so me de call me de the other team no ba mo the ambulance never team ni nyina the ambulance back no ma be see in the education fund there, environmental health fund there, community healthness fund there, public healthness there, health superintendent there. In the village you know, I dare say we are actually one time I was based in Agogo. Ye yening in every immunization, the Bema yening in area. Na ya follow up. Me na me call follow up. Inti to me be a me follow up. Kohwe cases no be na ubi a unya your man vaccination BBC and na magic data no na media. But what I'm trying to say is that for the development of each country, no, so mo jabi bia ko politics na mo yana man country no ni progress no retrospective go back. So ade back one kum Ghana ne gusu kum yen and he said aban bia ba no agyebusia ko bi do mu nwie aban foforo bia ba no agyebusia na ko bi do mu nwie eka no so ye ne etua eni ntino as a say community members na mo amwo power na mo yes ade mo realize say you are doing more harm than good to the country. Oh yeah, the healthcare you can was me about almost about 30-40 years ago. And as Ghana ye building on that ye developing on kakra ye correction is in mature. So and ye jai to honor. Ye jai to for many reasons. In fact, at the time as our concept ibano, the concept is involve a whole lot of development, road construction, school building, all kinds of things is part of it. So anything omo ye kwan bebre ye na yetimi ko crash ko ye nyuma bebre. Those days, no, they were immunized. Measles, yellow fever, assessment of yours, behavior treatment, all kinds of things were happening in the system. So, let's not say about politics, no, diabetic, acrano, the bar for cement was. And no, the papa, and no, the papa, a boy employment. About road construction, about school building, about unity and empowerment of the community. Health, because your health is your wealth. And so protecting your health and your wealth. So we need a wadia, hunya. So one wadia now team epehunya. And your health is your wealth. Always protect it. So, and the primary health care, no. The concept of primary care at the community level. So, nipa no yare or yare ya no, and that's one yare no. Na wo hu se ni usiti e. Enti se ntontom na wi na bema onya yare a, you protect ntontom no monom no nto yare. Da bi obekọ na fum, obeye na dwuma, o de aduane beba wa atikrom so benya bi adi. Ne bo obekọ fam. Na se o yare da ho a, na obaya waduane nyina bewu. Ebehia no. A comes to the mom workers, a multicrum. So, into a cyclical, a very important and very significant in health system. Only good for developing countries. So, obianya equal portion of on health because okono ekokan ne yare asem kirem on froka emma krum. Into debia no we sinisika. Or reducing the risk of accident. So, Anna Debian he's close with the family members. Najma Wayans with me because Debian so here be a member I healthy. He gets it. Because because now I scheduling. Krobia or time a caution. To do on ma now you took a near Kohon. And they also Prajan on the sacring on the co. Yeah, I think that the most important thing say you was get better ambulance at the amount. because the road nature na you want to know car beat is anti-minko. Unless you rehabilitate crime. You rehabilitate crime na and you bet me you should car papa the alcohol. Other than that, at this point in time, no, once started baby, you cannot move to another point.
Exactly.
You have to make a step to move another point. Yeah, I think say going with Pragia, those just need a motorbike neck on the distance Pragia by normal they can never boa. I think that it is a safe ground to use it.
Doctor, me bisa say per historical background na wo de amaye na che say aban bi ba sesi a obetumi aka say ono nso wajaye o nti no ede na wo se ye fa ho. Do we have to legislate or what just to protect this particular you know?
The Kobby, there be a make trust was a repetition and there be a maker. What was a free education by I say a very good thing because that free education, no, say it me twice for 20 years. In the next 20 years, Ghana will change. So, soon, a primary health care, primary care system here, President Peswa de Ban. Say twice a year, this healthcare system will change. The cost of disease will reduce. Building huge hospitals will stop. So I'm emphasizing what I cry. I want to say every good country be or person or develop in health wise or the emphasis in your hospital the emphasis go. The emphasis go on public health. Educate your people. Let them know their left and right. Let them eat good food. Treat diseases so that they don't expand into the community. Make sure so they get good nutrition. Now they are very healthy. Now those are the petty things. And then also aquafa nutrition. The agricultural side should also make its work well. So the bear and no by bit my so and never way no more any idea a be involve community based community based level on one educating na make the components help team no more agricultural educators won't be. Did they go there to educate them? So until way education they know where to go. So
I think what they are trying to introduce me say they will take simple tests, say glucose tests to see say sugar level, you check or blood pressure, and then say for any idea when it is identify say quickly then they follow up with referral name medication say I think say the walk idea be was a sustain because sebe free SHS here not done kwekufado tray muma obi enya ebie na current government so ba ya one megunu a egusu kwe no problem say wo mu nyina won say gradually no form say won feeding problem no bebre because then we are learning year in and year out. Double track system wo ho no bia yesisi dan ni bika ho nti ebedu baabi no na because I know say developed country bia no that is the way they developed almost started ade no na work ko sa ko si say ombetimi edu baabi a e wo se woduro.
Yeah, I answer na meko another legislative my main custom kitwe wa. Once ya tigana na ya hwe aburuchire kwan ya yes so pa e kwan bi as 6 lane but uba ha no so was study o mo pa unhu se sa 6 lane so anya dekonom de
Debi.
Wo mo hia na ya 1 lane and no buy mu ko 2 lane and no buy mu ko 3 lane no ka buy mu ko 4 lane and no madu buy 5 or 6 lane enti no ntimi va dekon ka say o yes de obruni aya ne de so because sha sentem and we could do baby on it is a primary health care senke ye sha se no ne anya ya nge senke do baby na asama me ka kire Ghana politicians ni say and them am parliament honum say mesramo a ya hokwo wa bonten be ye krom ni Ghana na yani ahwe Ghana pa yi obia wo abonten bia ni hwe Ghana nkwala ya wo ho akra still o mani hwe Ghana enti ade bia omo ye bia no omo mfa to no muntie nkrofo version about it na mumfa sa version no ko parliament on ko discuss no well na muhu the fruit of it no say a fruitful mo dia ya adwuma say you can ignore it na ade ye fruitful bi answer some party politics will not infiltrate into it na say yi party bi afiri ho no ma and as a government party bi afiri ho no ma de obeba na hu say a very important thing ye mu nyina na mo ye say mo ye no sa ade a mo beboa ma yen ye wa bonten no say ye adwuma na discover mo ye de bebre mo akasi mu na say mo anya ne sa na mo ko na we titi we na sem papa nse ye ka no mo ndima mo po afanto say be ya independent from the parties no na niema na aye adwuma se ne tie ne dia ene na mo how man.
Yeah, okay. Finally, adeɛ baako a ɛwɔ primary health care na mu a mepɛ sɛ yɛhwɛ ne sɛ president ɛka biribi sɛ ɔmo bɛyɛ yɛka ne sɛ container clinics ɛnyɛ sɛ ɛyɛ clinic kɛseɛ but at least ebi a village bi a ɛhɔ so a wontumi nsi ebi a chip compound wɔ hɔ fa ne sɛ yɛmfa ne sɛ ebi a mewɔ village bɛ mmiɛnsa saa village mmiɛnsa no baako so a ɛhɔ no yɛbɛtumi asi chip compound a ɔmo aka no nyinaa bɛtumi aba hɔ for referral but saa other 2 villages na ɛyɛ nketewa no yɛde saa container type of clinic bi bɛkɔ hɔ enti no volunteers no ne ade a ɛne nurses na ɔmo kɔ village wɔ kɔ yɛ adwuma no ɛyɛ adwuma na sɛ bi ehia sɛ ɔmo yɛ quick you can say be they can somebody will also be there all the time say anaju a couple of 1 or 2 people will man that particular facility no almost be to the primary care na ama okay. But I know so I'm say
it's not different from the primary health care na you can have so say make a choice say you trainee and conform from the regional level all the way to the rural
local level.
Maybe I'm one. Health attendant near from health. I think so near from health attendants. One more. Corona woman.
The Oma Meka umpire traditional birth attendant no.
Almost
no because I say brother, my sister or one of the villages no na. There was a woman there, I don't know your traditional birth attendant.
Yeah, one more traditional birth attendant, no, you have attendant no krum.
Okay.
Now, I have attendant no also one more renty obi store, dank to a be okrum the man. Honor one more basic needs no. You're training no. This is krum as a certified nursing assistant. And you're training on not take room. And then to say, Bibi this obiti and ya. Na be a snake bite be a point of us obet prevent snake bite from allowing the venom not to go into the system no Mr. Damanti and no dear President Mahama say on rent will be a die the on be used to containers at the acquisition granas in why I think that it's in good line. But those days, no more rent for fee and I volunteer. I will be volunteer. I think that it is on the line. All that I'm trying to say is the improvement of this, the educational aspect of it now. And the final thing I made me here. One of my evaluation in of France area, and he said, "One more 18 months, my assistant, no matter your quack doctors who can and only idea."
Quack doctors.
Quack doctors. And you know, but my example be there was a time I call evaluation. I'm saying you're forcing Kurani back once. A banker area. Me call na obisin ani ya. And you know, him say a team no baho that night that day no. In the attendant na no work room no. Previously not what the paracetamol no ahono. no dia wo nipa ko na ni ha sei
Oh,
say na ni na ya ni ano konti that day ni agogo doctor me friend doctor me findi no you have eye special you know na ka call that day di ko ko hu ade me se film kakra nti ya hwe akwa na akwache no so ndi dia kan say primary health care no one pros and cons
cons.
in the pros no ya ade say mo be educate on na mo my disciplined near on timinye no and say what trash wo be ye near also refer no so mo man information any papers are obefere obehunu ade no refer to the next post and koyasa na ye kase ye tu magomo nkonko ye no se de omo ye no na at long last no ye ebeye more harm than good na eno ni ade a ye hu no previous one after the evaluation no ye hu no previous one mti ye ade a hia se omo betire no omo medical level omo betire mu preventive level omo betire ni omo maternal regional office regional administrative office omo betire omo district administrative office no and team no omo ye adwuma ni should be well trained and well disciplined because they say no anyasa I be corrupt omo more than benefit as the man no otie kura na say ojijiska edi ehonso ni ye free you know the man
Free. Say we grant you free.
no
No, Jimuska.
no ojijiska the turu botum abran so ojijiska wo ho enti na idea a very good concept say minimum bi wo ho no ma minimum say doctor no hui or ho shi ya friend Dr. E.N. Mensah or ye one of the members na or yet I'm sorry, one of others at a certain point in time he was the chairperson for this primary healthcare right now initiative no Kintampono. You know he's vested in it. It is President Mahama say who person unya advice be free primary healthcare ne plan mu a ebi a okọ pension sisi a me feel say obetimi advice him very well because he taught it, he experienced it. He went to the bush to do everything that involves this kind of, now he trained some staff about it. Or a very good person advises a team way. Because we hear advice, Mama Yamaji said, but it has happened in the country before. It has been implemented in certain areas before. It has been evaluated in certain areas before. And and some would taking the facial values without going into those data to see the pros and cons in it, so that when you go now, you can ratify the problems, and then rebuild and make it a success.
All right, Doctor, we there you better was pa and na me can de biano President Mama ka sembi o se unnim a no wabisa na pragiano de abana enye ambulance ye de o se echire no kura no omo cooling eyi wo ho a eno na mutimi di basic drugs say de obi owoka obi a de woni pane ne ade ni na no any vaccines ahodo nyina mutimi di gum say be ya best store no as long as omunye nyusu ye na best store no I think say eno na nwumre ya ye because to be frank manya more education pa on the primary health care na primary health na omo pese omo de ba no and I omo de aba no and I think say ebeboa obi a obetie bia na say obe chance on the video no na ono nso ehun say ade no a aba no enya de a eye rocket science ade bi asipen ba hwe ne yanhwe so yie se de da bia ga na ye ne ma no ye nhwe so yie ne ase no nti we de ye nyina be guide against some mistakes na kane eye na etumi aboa yen ama yenya apomuden ama ye manfo a wo nkurase in particular din se omo be access healthcare because of sikasem ne ade no ye da sipi menim se bia wo final word bia wo beka ansa na afi ma sign off.
I'm saying the Americans say right now you say you're training a lot of nurses. Our system and say President Bear taking upon himself and the those days no the crash no you only one village attendant. Only delivery attendant. A team of delivery attendant are normally a Juma community. But say you were trained staff, no dear. I believe say one registered nurse crown or obey sacrifice obey my community anymore. Be upgrading kakra. Other than that, no, only the obenya access we can do a lot. So trained staff obey a lot for the community. In fact, now one single attendant. I work room also mobilize now. Some mobilize delivery attendant Libya. But I think
Doctor, I say you were more midwifery people are almost school. They are sitting at home. Midwives.
Yeah, but Kobby, besides staff, no equipment here.
Yeah, I think me here say few no, but I think say they brought some pieces of equipment. A whole lot. Thermometers, Nina say for near there. Is it we call it? Do you call it thermometer? And I'm friend saying, says I'm friend no.
Yeah, I know your basic thermometer and glucometer.
Yeah, almost say
and I'm making it be a
hence I near money now more. And as I say, so they are thinking of equipping chip compounds, you know, because I want about a referral point now. And they are thinking of equipping the chip compounds with a few maybe bears, a few equipments are a boama chip compound no say refer bar to me a treaty and sana say be here further referral they are called district hospitals no. I think this is the near cranium bar lunch no, they showed it and the nona pragiano ni motorbikes near part of it.
Okay, the Americans the structure no should be well formulated. So and one day show no more yet. Idea and the coverage wider to the community. Maybe was see chip compound biano wings be chip compound no serve. In the chip compound site no is the center for some particular team no more year juma. The team no quad they come back to the chip center. And the reference be initial reference biano comes to the chip center chip compound. And you know, as a structured thing. So besides other chip compound no administrative sector. And this primary healthcare should have its own administrative sector. Now it should be monitored. So evaluated and monitored. So why evaluate and monitor? You are doing nothing. So evaluate data quality, good data. Who said information when they cost they send the information to the national statistics. National statistics will work on it and give the Ministry of Health an information to know what is happening in some communities. Now, Boama Abano say, "Oh, per se, important no be who say I drew when you hear, and yet say, because it's no be breba or manuma, na air cost is can be brinty. When I want more, and yes, treatment, it helps them to formulate good policies in healthcare."
Okay, all right. Doctor, any you better was it. If you better musuma say moje bre na mobile na fe ne mu discussion no. We echinsu obi a won sabeka video no bia no. Once we betumi a share with the authorities na omo nso omo ehunu say diasporians no so perspective about the primary healthcare na yasama one doctor ye feel say ono nso enim de mu pa enti mpanimfo betumi ahwehwe sa doctor no nso na omaboa de ye ka nyina ne say yene a yete abrochire no said de doctor D kankan no yeni da so hwe fie o esan say yenim say ye den a yenchi ni fie enti no bibia ekoso wo fie bia no eho hia ye enti eya ma enye sometimes the one for because omo ti abrochire omunya bibia omo de omo fa ye ho be but the ye experience wa ha no eno na ye pese yensu ye krom ebiba because metimi aba holidays na me bana bibi beto me na say health system no nya ebetumi ahame eno nti ɛwɔ sɛ yɛ nyinaa yɛboa na afei mo a yɛbɛtreni mu sɛ monkɔyɛ volunteers no monkɔdane mo ho quack doctors na afei monkɔgyegye sika engu mu botom ade no yɛse ɛyɛ free primary health care nti no yɛtua wo ka deɛ a ɛni sɛ wo nso sankɔgye adamudie biara ansa na wahwɛ obi wie ɔmande hyɛ ɛne deɛ yɛde mu bɛsie no nyame yɛ adom a yɛbɛsan ahyia biem ɛma mmoniti a ade hyɛ
C'est mon père, ça me fait bien tiens. Tu me fais dire non kotu, era one radio. C'est mon père, tu me fais bien tiens. Tu me fais dire non kotu, era one radio. Oh, and you pam asam pam Chintu,